Hello, everybody. Welcome to the first episode of this hip replacement, finding our bodies again, finding our physical form. We're going to start with activation. And if you've gone through physical therapy, you know that that's one of the first things that we have to do when we have our hip replaced is activate the muscles around the hip. So we're talking the glutes and the core. So I'm in on a mat. I'm going to show you how to do all of this in a chair as well. So we're going to start on the mat. So the first thing we're going to do is just sit tall, okay? Tighten up the belly and then pelvic tuck. I'm taking my pelvis and tucking it under, and then I'm lifting. So my tail goes under, my tail goes back. I can feel this in my hip. I can feel that activation. My left hip is my affected side. So we're just going to do a couple pelvic tilts. That's it. It's going to be super mindful because mindfulness is where it's at. One more. All right. Now I'm going to come all the way down onto the floor. And if you need to have a chair to get there, feel free to take a chair to get there. Now I'm going to take my hands onto my low belly, just where I was in my pelvis. And I'm going to do the pelvic tilts from a supine position or on my back. So I'm going to tuck my pelvis and then make my pelvis neutral. Tuck it and neutral. So I want you to really feel the buns engage and the low belly. So here's how I've taught it before. We have a cup of tea on our belly right here. We're going to pour the tea into our navel and then flatten it and fill up the tea. Pour the tea, fill the tea. So that's a nice way to think about the pelvic tuck. We're going to just do 3 more of these. You should be feeling some activation in the core and then just a little bit in the cheeks. Now, I know that one of the things all of our PTs had us do is heel slides. We're going to do it again. So take your unaffected leg, which would be my right leg, and I'm going to scoot my heel down and bring my heel back. I'm only going to do 3 on my unaffected side, but I can feel my quad getting a nice little oomph. And now the affected side. I'm going to slide the heel and then bring it back. So I'm going to lower this leg so you can see my affected side. I'm going to slide and then I'm going to bring it back, which is really hard for me. Slide, point the toes up and bring it back. I'm going to do 2 more. Press and come back. I really feel that in the front of my hip. Let's do 1 more. It's really hard for me. And I am 16 months out. All right, here we go. Bend both knees. Now I'm just going to let my knees open like a little butterfly and squeeze back. So here's where we activate the inner thighs and the outer leg, those abductors and adductors. Just do 1 more. Perfect. Now we're going to come to, it's a little bit hard, but we're going to do it. Every time you go to the doctor, they have you do this. So we're going to do it again. Eyes to the ceiling. You're going to peel the hips up, squeeze the buns, come to a bridge, and then lower it. Again, lift and then lower. Just do 2 of those. Okay, 1 more, 1 more. And then lower. Those core exercises are so important for activating the area around our hip replacement. So our core, our buns, our inner and outer legs. And I'm going to show you how to do all that in a chair. Stay tuned.